A concern now this week as we head into the new year about the tripledemic of COVID, flu, and RSV. COVID cases in this country have mostly flattened out, but hospitalizations and deaths are both up. And then you look at what's happening in China, seeing by far its biggest spike in cases since the outbreak first started nearly 3 years ago. Hospitals are getting overwhelmed with the number of serious cases as China is announcing it's easing up restrictions on its COVID response strategy. I want to bring in NBC's Raf Sanchez, who's covering that angle for us in London, and Dr. Lipi Roy, who's the medical director of COVID isolation and quarantine sites for Housing Works in New York City. Raf, let me start with you because there's this interesting statistic that the CDC points out that says China has not reported any COVID deaths for 5 straight days this past week, despite what appears to be a massive spike in cases there, given the easing of restrictions in China. Help us understand this.
Yeah, Hallie. So there have been a lot of questions about China's official COVID data since the beginning of the pandemic. Those questions getting a whole lot deeper now that just as China is lifting restrictions, it is also stopped publishing daily COVID data in the midst of what is clearly a major surge. And that is causing a lot of concern around the world, including at the WHO. They say it's really important for everybody to have a picture of what is going on with COVID in the world's largest country. But Hallie, even without official data, we can see this is a major, serious surge. We can see it in videos that are coming out of Chinese hospitals that really look like something from the early days of the pandemic. You are seeing emergency rooms that are totally full up. Every single bed is full. You have anxious families agitating for their loved ones to get treatment. And you are seeing some patients in the hallways on oxygen in some cases. So China is in a really difficult position right now because these lockdowns have been so severe for 3 years. You have a population that doesn't have a whole lot of natural immunity. A relatively small proportion of people until now have been exposed to the virus, have come through the other side, have natural immunity. But you also have a population that isn't that vaccinated, considering the amount of time they bought with the lockdowns. Only about 60% of Chinese people have had their booster shot, and these Chinese-made vaccines, scientists have found, are really not that effective until you get up to that third booster. Now, Hallie, the official explanation from the Chinese government for why they are abruptly dropping this zero COVID policy is because Omicron, they say, is less severe than previous versions of the virus. It doesn't cause as many hospitalizations and deaths, which is true, but we've known that for a year and a bit now. What many political analysts will tell you is this is a response to those major protests that we saw in China last month, this month, something we really haven't seen since 1989 in China. People on the streets of major cities like Shanghai protesting the lockdowns in specific, but in some cases really kind of challenging the authority of the Chinese government, calling for the downfall of Xi Jinping, calling for the downfall of the Chinese Communist Party. Hallie, I will tell you, there is a lot of concern in China about these rising case numbers. There is a lot of concern about these rising hospitalizations, but there is also a lot of relief that finally, this seemingly never-ending lockdown does appear to be coming to an end. Hallie.
Raf Sanchez, thank you so much, Raf. Appreciate that. Dr. Roy, let me ask you, how much are public health professionals here in this country watching what's happening in China?
We're definitely watching, Hallie. It's good to see you, by the way. It's really tragic, frankly, what's happening in China. The healthcare systems are overwhelmed. Emergency departments, ICUs, fever clinics, overwhelmed, mostly with elderly patients presenting with COVID-19 and pneumonia and other respiratory type symptoms. This is not at all different from what we're seeing here in North America. In the United States, we're seeing cases rise. And we're actually, as you know, we're seeing a tripledemic. We're seeing a rise in various infections caused by multiple respiratory viruses. There's two things that Rafe mentioned really well in his excellent reporting, which is this rise in other infections because in the last 2-3 years, we've been isolated. People in China have been isolated, practicing mitigation measures, masking. And as a result, he's basically just explaining an immunity gap, right? That's why we're now becoming vulnerable to these other infections. The other thing that Rafe mentioned in his report is that the vast majority of people that are presenting in hospitals in China are also unvaccinated. This is very similar to the CDC data that we've known for the past couple of years, which is the vast majority of COVID-related mortality is among unvaccinated infected individuals. So we are definitely concerned here. We're seeing cases rise nationwide in multiple hospitals because of the combination of SARS-CoV-2, which causes COVID-19, influenza, and RSV. Luckily, that latter virus, the cases are going down. It's mostly among children, but still, we need to be very, very mindful of what's happening right now, Hallie.
Dr. Roy, thank you very much for that perspective and your expertise. Raf Sanchez, thanks to you as well. Appreciate it.